Hi everybody, I am Dr. Suresh, Senior Consultant Physician, Manarkad, Palakkad. Today I would like to present a small video regarding isolation of corona patients in home and their treatment. We all know that the number of cases increasing day by day. For the last 2 or 3 days, the new cases were 3 lakhs, 4 lakhs, like that. We cannot, or our medical system cannot, accommodate such a large number of patients. Initially, we were treating all the patients in hospital. Now it is not possible. So, policy is to treat severe and complicated patients in hospital and other mild cases in home itself. Very important point, we have to note that once you diagnosed as a corona patient or one of your family members are diagnosed with corona, you should not be or you never be panic, because 90% of the patients diagnosed with corona will recover by themselves without any complications. Only 10% will go into complications. Among the 10 itself, only 5% are going to severe complications. We all know that prevention is better than cure. Each and everybody will be familiar with SMS, that is sanitizing, mask and social distancing. And now we have a fourth weapon in our armamentarium, that is a vaccine. Many of us are or were reluctant to take vaccine because of some false news spread through social media. But it is proven beyond doubt that all the vaccines available in India, that is Covaxin and Covishield vaccine, both are safe and effective. Our 2 vaccines are among the 13 or 14 vaccines available in the world, and these 2 vaccines are approved by international bodies also. If you are fully vaccinated, even if you get corona, it will be very mild, and the number of complications or seriousness will be very less if you are fully vaccinated. So you should vaccinate as early as possible, at the earliest. Now we will go to home isolation and treatment. This is very important, and we have to know 3 points. 1, diet. 2, exercise. 3, how to monitor complications or how to monitor the patient. Diet, we all know, very simple. There is nothing called corona diet. It can be explained in a very simple way. Look this picture. This is a plate. It is divided into 4, and 1/4 of the plate should be carbohydrate like rice, chapati, bread, whatever be. Equal amount of that should be protein. Protein means dal, pulses, grams for vegetarian, and for non-vegetarian it may be fish or a chicken, whatever be. But thing is that it should be easily digestible, as the patient is not in a position to digest very heavy food. The next half or remaining half of the plate should be filled with fruits and vegetables. These type of diets, you will get immunity and you can fight corona very effectively. Other thing is exercise. For exercise also, there is nothing called corona exercise. Importance of exercise is that many corona patients are going into depression and they have some physical problems. Also, they complain sleeplessness. By doing exercise, we can fight against this to some extent. By doing exercise, the release of dopamine, serotonin like secretions will be more, and this will increase our well-being and also sleep will increase. So what are the exercises? These are general exercises to improve our health and to increase the cardiorespiratory capacity. Number 1, we will relax our muscles. Flexion and extension of fingers. You can do this for 30 or 40 times. Next is wrist rotation. You can rotate your wrist clockwise and anti-clockwise. This may be done for 10 or 15 times. Next is shoulder rotation. You can rotate your shoulder for 10 or 20 times clockwise and also in anti-clockwise directions. For the neck, you can extend and flex your neck for 5 or 6 times, and you can move your neck to sideways, right side and left side for 5 to 10 times. Also, you can rotate your neck clockwise for 3 times and anti-clockwise for 3 or 4 times. You can do it evening and morning and also in between if time and health permits. Now we will go to lower limb. You can flex and extend your toes for 10 or 15 times. Also, you can rotate your ankle joint. You can rotate clockwise for 10 times or 5 to 10 times and anti-clockwise for 5 to 10 times. Also, you can flex and extend your ankle joint 5 to 10 times. All these exercises which explain can be done in sitting posture itself if health not permits in standing position. Next is hip rotation. You can rotate your hip 5 or 6 times clockwise and anti-clockwise. If health permits, you can do push-up. That is up to you. Now we are going to exercise which will increase the lung capacity. It is also very simple. 2 exercises we can do. One is hands in and out breathing. Hands in and out breathing. For that, you can stretch your arm in front of your chest and along with inhalation for 4 seconds, you gently bring your hands backwards. Rest there for few seconds, 3 or 4 seconds, and gently by exhalation bring your arms in front of your chest. This can repeated for 5 or 6 times. Next is angle stretch breathing. In standing position, you bring your hands in front of your thighs and gently along with inhalation take your arm upwards by 4 seconds. Along with that, the angle also should rise. Remain there for 2 to 3 seconds. After that, gently you exhale for 5 to 6 seconds and bring the hands downwards. This can repeated for 5 or 6 times. If you are not feeling well, you can do this without stretching your angle, gently or simply raising your hands itself, or you can do it by sitting or lying down also. This is general outline for exercise. You can increase the number of exercise or decrease the number of exercise according to your health. Now we will go to monitoring of patients. Once you or your relative contract corona and we are keeping the patient or relative in our house. So what are the features or what are the things you should monitor? Mainly 3 features you should monitor. 1, pulse rate. 2, respiratory rate. 3, oxygen saturation. Another thing, if the patient shows high grade fever for more than 4 or 5 days and if he have some behavioral abnormalities, it is a bad sign. Now how will you monitor the pulse rate? You can check the pulse rate just above the wrist. Normal pulse rate is 72 per minute. If it goes beyond 120, then we can assume that there is something going wrong. Next is respiratory rate. How will you monitor respiratory rate? You just lie down simply and put your hand on your abdomen. You can see that abdomen is coming up while you inhale and your belly is going down while you. So this movement of tummy, that is coming up and going down, this is 1. And how many times this coming up and going down occurs? This is the respiratory rate. Normally it is 14 to 18. If it goes beyond 24, we can assume that something is going wrong. Another thing is oxygen saturation. We all know the term happy hypoxemia syndrome. That means normally if you are deficient in oxygen or if you have deficit in oxygen, you will get some discomfort and you will run for oxygen. But in many corona patients, it does not occur. Oxygen saturation will go down and it will reach in such a state that he will collapse and will go into serious complications. So it should be prevented. We can use a very simple instrument called pulse oximeter for that. The normal oxygen saturation is more than 94. If oxygen saturation, that is SpO2, it is more than 94, you are well and good. And if it is less than 94 and above 90, you are in moderate patient. That person ideally should be kept in ward of hospital and should give oxygen. But due to the deficit of hospital beds and due to the rapid explosion of number of patients, if you have oxygen in your house and if you have contact with some medical person like doctor, you can keep the patient in your home and should monitor whether the patient is going to SpO2 less than 90. If it is between 90 and 94 and with oxygen you can increase the SpO2, it is well and good. But you should monitor, and if the SpO2 goes below 90, there is no doubt you have to take the person to hospital facility. When you are keeping the person in your house, it is better to keep the person in different postures. That is, for half an hour you can keep the person in prone position, that is lying down on the belly, and next 30 minutes you can keep him on right lateral position, and the next 30 minutes you can keep the person on supine position, that is lying on the back, and next 30 minutes you can keep him on left lateral position. This will give oxygen to all parts of the lung and a better feeling for the patient. If the patient goes into complications, you have to take the patient to hospital. And very important point, you have to remember that in many patients, if he is kept in prone position, that is lying down on the abdomen, he will get some more oxygen and he will be feeling some more comfortable. So when you are taking patient to health facility, you can keep the patient in prone position.